Now we're going to try and continue that conversation with the Health Ombud, Professor Taula Mokoena. Professor Mokoena, I hope I have you back. I was just asking how it got to a point where this health facility was so deplorable that it didn't even have power for a year.
There are several reasons. First of all, regarding the power, because that's really what precipitated the death and therefore our investigation there. The power was off because the power cables were stolen, and the substation that feeds the hospital was vandalized. Now, the electricity went off such that there was no electricity to power the HVAC system. In other words, the heating and the ventilation and aircon system. And that's number one. Number two is that the hospital has got a very serious shortage of staff, especially professional staff. And thirdly, is that the equipment that there was shortage of equipment, especially the resuscitation equipment. This is over and above the fact that in the absence of electricity, some of the equipment that need batteries was not working because these could not be charged. But paramount to all of this is that there's a fluidity and instability of management from the provincial health department down to the hospital itself. In the absence of management, there's nobody to direct and lead the hospital to do what it needs to do on a day-to-day basis. And therefore, the electricity, the lack of electricity went on for a good part of a year, whereas the adjacent properties, the private hospitals adjacent to this mental hospital, they could restore their electricity, which is fed from the same substation within days. So the problem are manifold. And now the fifth, which I haven't mentioned, is that although the hospital is chronologically new, because of what we gather is poor workmanship, the facade is crumbling already. The sewer system is not working, and the walls and the ceilings are peeling and collapsing. For lack of, firstly, because of poor original workmanship, but secondly, for poor maintenance and repair.
And I actually wanted to ask about that, and you've luckily mentioned that, about the neighboring hospitals being able to restore their power supply. They're happening to be private hospitals, though. In your report, you also found that the clinical manager had actually raised a red flag, and spoken to the acting head of the provincial department, warning about the harmful conditions, and it seems that nothing has been done. You've also mentioned now a leadership crisis as well. Are heads going to roll after this? Who should be held accountable?
It's not only one person, but of course they say that fish rots from the head. So the first issue is the provincial Department of Health, the officials there, their heads need to take account. But I need to hasten to and say that I just said that there's instability and fluidity, that during this period, most of the senior management positions were filled by acting people. And it is a fact that acting people don't usually have the power that is necessary for them to make and take difficult decisions. Now, be that as it may, somebody needs to take account, and that lies in the office, not necessarily the people, in the office of the provincial health department.
And hopefully we do see those recommendations being taken seriously. Professor Mokoena, thank you so much for your interview, but also that investigation into what is really, like I said, harrowing incidents that have been taking place there. Really appreciate it.